Good morning once more, colleagues. We want to take this opportunity to welcome you to this press briefing, as it were, or press conference of matters that the panelists here with me will expound on. Like we mentioned, the issue of... Good morning once more, colleagues. Access to information. Now, challenges have been there on access to information. Remember, access to information as a principle largely was started as something that was being pushed by World Bank as an accountability measure. So for quite some time, a number of our governments resisted an access to information law simply because they thought it's corruption. But increasingly, and studies have shown, and colleagues working on the matter will talk about it, access to information is an enabling law. It's an enabling policy related framework that, if embraced fully, helps in a lot of things, including allowing people to make decisions to invest, decision to go for to look for services and other things. So it's purely a human rights thing that would enable if it was respected. But obviously it has been getting more challenges, not because we don't have a law, but increasingly because largely of culture, that while we pass the law, but a number of people in decision making, most of our public institutions, still old school and are still stuck in a culture of secrecy, where you still find even things, obvious things like newspapers are still stamped private and confidential. So we are, as we address this matter, we're also looking into how do we loop in our colleagues, especially public service and county governments, to start embracing this law to help in the economic and related development that it's supposed to help, and obviously helping people actualize a number of their rights. So without going into much, as we are aware, a number of our colleagues took a petition, obviously related to COVID-19, but once it is done, it has bigger implications. It will help in families, individuals, and Kenyans at large. So without going into much, I would welcome, obviously media, as a media person, media will be the biggest benefit from this, if it was, because a number of counties, I'm aware, I will not name them, but we have 6 counties actually, which we are having challenges with journalists. They asked very basic information: how many ICU beds, how much money has been spared for COVID related, and up to date, 3 of the journalists were beaten up and roughed up by the county governments and others. So it's an issue that also interests journalists at a big level. So I would quickly then welcome my colleague Nelima to then give us a background introduction of herself and what they are doing on the matter. So karibu sana.
Good morning, colleagues, and thank you very much, Victor, for the introduction. My name is Nelima. I am counsel for the 1st to 8th petitioners in this matter, as well as the 10th petitioner. And I work within an organization known as Kelin, the Kenyan Legal and Ethical Issues Network on HIV and AIDS. As to borrow from the words of our president, we are in unprecedented times. And as a result of that, we do require a different way of working and a different way in interrogating how we work. And this is what this petition seeks to do: really question how information is being made available to persons, how information is being made available, and what information is being available to ensure that we are able to guarantee both the life and health of Kenyans. As the coronavirus numbers are increasing daily, both in terms of deaths and active cases, we have to ask ourselves, do we have the necessary information both to prevent infection, to promote healthy behavior, social distancing, and other restrictive measures that are being put in place, and to prevent death eventually, which has happened to already over 160 people in this country? And these are some of the questions that this petition seeks to ask. What information must be available proactively? We're in a pandemic. What should the state have told us proactively without us having to ask? And if it's not provided proactively, what obligation does the state have to ensure that when you're asked for information, which we have done in a number of letters to the state as organizations and as individuals, that you must respond either within 48 hours or 21 days. If your country is in a pandemic and you fail to provide the information necessary to ensure that the virus does not continue to spread, how then shall we be able to arrest it or seize it? Further, if citizens ask you for information that necessarily should be made available because we are paying our taxes, we have voted you into these positions, how should you react to those requests for information? So these are some of the questions that are being asked by my organizations and the first to 8 petitioners. The first, second, and third petitioners are community health workers and volunteers working in Kisumu, Siaya, and Mombasa County. Each of them consistently have questions from their citizens, from the residents within their counties on what they need to do on a day-to-day basis to prevent infection, but also to access other health services. Mothers are staying at home because they're unable to access health services because they don't know if they can go to hospital or if they should stay at home. Children are not being vaccinated, both in Mombasa County, Nairobi County, and these are questions that are not being answered either by county or national governments. The fourth to 8 petitioners were persons who were held in mandatory quarantine. Each of them had traveled back into the country, and upon arrival, they were told that they would be held in mandatory quarantine for 14 days with no other information. They didn't understand what the protocols were, when they would be tested, how they would pay for this quarantine, what would be made available to them when they were in quarantine, how they'll be provided for other health services if required. So they spent 14 to 28 days within quarantine facilities not knowing what was happening, not being given the information necessary to ensure that they were healthy, and not also being told what it meant. Some of them were even held further and told it's because they didn't observe social distancing without the state having put in place protocols to guide social distancing within a quarantine facility. Such problems are necessitated because we are not providing citizens with information when they ask for it. The Kenyan Legal and Ethical Issues Network on HIV and AIDS, as I mentioned before, is a right to health organization. So we work to promote and protect the right to health in this country. The right to health is threatened at this time. We're in a pandemic. Yet we remain in a position whereby we do not have the necessary information for ourselves as an organization and also to provide to people that we work with. We cannot tell you left to right how many ICU beds, as has been mentioned, that are available, how many healthcare workers have been trained, how many healthcare workers have been trusted, how many healthcare workers have necessary protective equipment, how many citizens have necessary protective equipment, how many commodities are available at this stage. We have a breakdown of large sums of money being received. We're unclear how this money is being spent towards protecting the health and lives of Kenyans. So we remain concerned that 10 years after our constitution, we've been given these aspirations and promises. We cannot go to the Commission for Administrative Justice to ask for information and get meaningful responses. We cannot go to the Ministry of Health to ask for information and get meaningful responses. We cannot keep drafting constitutional promises if we do not mean to meet them. So what we do have to ask is a court to determine and to decide, what does it mean when we have this provision in our law? What is the obligation placed on the state agents, and state ministries? And what is the role of the Commission of Administrative Justice to ensure that Article 35 is realized? Thank you, Victor.
Asante sana, thanks. Without wasting, I'll go straight to Lempa.
Yes, my name is Lempa, Litigation Counsel at Katiba Institute. And we are in this petition because if you look at the petition, it's because it seeks to enforce the right to information because information is very important in the running of any democratic society. This right is closely tied to the right to expression, because if you look at the right to expression, Rarely would someone who is ignorant of information be in a position to express him or herself. Katiba Institute champions for the rule of law and constitutionalism. I would like to thank Were, the speaker who has spoken before me, in saying that we pay tax. I would like to say, to add to it that all information that is held by the state or by state officers is held in trust for the citizens, because citizens pay taxes and that information is either generated or developed through taxes. So anytime a citizen asks for that information, the citizen is asking for information that he has contributed directly in generating. And therefore, the state cannot be heard, or any state officer cannot be heard to say that this information is not available to you because it is held in trust for the benefit of the citizen. So therefore, Katiba Institute finds it very necessary at this particular time when the whole world is grappling on how to deal with COVID-19 or coronavirus, to have all the information that is necessary for the citizens to be in a position to use this information to take care of themselves and to take care of their families. The Ministry of Health and any other government institution that is in custody of any information must know that that information must be consumed to the people whom it holds that information in trust for. So therefore, we pride ourselves as Katiba Institute to partner with other institutions, because we believe and we know that any change in the society requires broad coalition of actors. It cannot be Katiba Institute alone, it cannot be ICJ alone, it cannot be Kelin alone. A broad coalition of actors must come for them to create the requisite impact for even those whom doors are being knocked to provide certain information to realize that this information is really important. And we also are in this petition to share our experiences and our experiences in court, because we've been in the forefront of not only enforcing the right to receive information, but other rights in the Constitution. If you do not have rights, if you do not enforce your rights, you cannot participate effectively in discharging your civic duty as a citizen. We believe and we hope that with time, when civil societies and other actors join hands, the impact is greater. And that is basically the reason why we are in this petition. And some of us were really sad when we saw the state stigmatizing the dead in the burial that was I think in Nyanza, where the dignity of the dead and the dignity of the family. In law, we normally say that a dead man has a dead body is of no has no value to some extent in law, but we know our culture and the stigma. If we stigmatize people by the way we handle the dead, it's very sad. In that the right to culture is one of the rights that was not in the old constitution, but right now it's in the new constitution, and therefore we believe that COVID-19 is not even like HIV, which is associated with personal behavior. This is a pandemic that anyone can get, in that it's not, you need not to behave in a certain way not to get it, although there are precautions that we are told to take. But over and above, stigmatization of patients or victims of COVID-19, and even the type of death that have risen as the state tries to enforce the protocol, is something that cannot go unchallenged, because generations to come will actually ask us what happened when this was happening. So Katiba Institute would like to be in that group of people who challenge the system and the way they enforce the protocols, and they would like to have as much information as possible for that history to be as accurate as possible. Thank you very much.
Asante sana, Vincent. I'll quickly go to Teresa Mutua, karibu sana.
Thank you. Thank you very much. My name is Teresa. As you've heard, Teresa Mutua. I'm a program manager at the Kenya section of the International Commission of Jurists, which we call ICJ Kenya. And we appear in this petition as the 11th petitioner. And allow me to say that ICJ Kenya is a human rights organization, and we pride ourselves in that our contribution to the society is based on our legal expertise and international best practices. And why I say this and why it is important is because the reason we're in the petition is because we are disappointed that while as jurists we participate and we contribute towards the development and even review of laws and promotion of laws, as Lempa has said, constitutionalism and the rule of law, we are saddened that while we have laws that are good laws, Article 35 of the Constitution on access to information, the Access to Information Act, which ICJ Kenya contributed, and the rest of the organizations joined in this suit, and many, many more, we contributed towards the development of these laws, and they are quite good laws. But we are disappointed that the government and the state, which has their responsibility in our constitution to observe, to promote, to respect the rights of Kenyans, has gone ahead and violated these rights and has not taken steps towards the fulfillment of these rights and many others which we have talked about in the petition, including the right to health, the right to life, the right to dignity, security of person, which are supposed to be enjoyed by Kenyans, which is why we are in the petition. Now, as part of our contribution, when we saw during the COVID-19, the way the government was responding to it, we were alarmed by it, and we joined other civil society organizations in writing several letters that span over the month of April. And we questioned some of the actions of the government. So for example, we questioned the quarantine and the mandatory, the way they were implementing the mandatory quarantine response. And we questioned it because, as Nelima has talked about, we were worried that they were using methods that put Kenyan citizens to much more danger. They were mixing people, for example, who come from the airports who have not been tested. And so people who are positive of COVID-19 and people who are negative of COVID-19 together, and without being mindful of their health and their life, the manner in which they were containing these people also was not right and is not in adherence to international best practice and the right to life. They were not giving information, which is key. They were not giving information as to how they are going to conduct this quarantine. In previous letters, we have also written to them questioning the extension of the quarantine period. They do not give that information, and Kenyans will know that what information we have been receiving is how many people have been tested, how many are positive, and we receive those quite a bit. But the information, even as Nelima said, how many beds? County is telling us, how are they prepared? How are they testing? How are they putting these people in quarantine and ensuring that they do not even reinfect each other? And those are our worries, among many others that we have written in the letters, which you will have access to. And the issue for us as ICJ Kenya is we have come up and we are asking the court to make a determination that these rights have been violated, that the state has abrogated its duty to, one, provide information even without being asked by Kenyans to do so, because it is demanded by the Constitution that they do so. And number two, that as petitioners, that we wrote to the state, different ministries and departments, and that they have failed to respond to our letters and information requests for information, and that those should be pronounced as violations, and that the court should demand of the state to answer the questions and the requests for information that we have sent. Thank you.
Thank you, Teresa. I'll go straight to the Executive Director for Transparency International Kenya. Sheila Masinde, please.
Thank you, Victor. I will give the reasons why Transparency International Kenya is part of this petition. Access to information is a right that TI Kenya has advocated for actively in the last 20 years. And we have been on the front line of advocating for legislation, which we now have together with CSO partners here, and are now monitoring the implementation of the law. We have also taken other matters to court before to push for the right to access information. Working towards a corruption-free society, information on the use of public resources is particularly paramount to us. Now, one of the main challenges we have experienced during this COVID-19 crisis is lack of access to information. Having presented joint requests, as has been articulated by my other colleagues from our partner organizations, we've presented various requests to the Ministry of Health. And unfortunately, all the requests to the Ministry of Health are yet to elicit response, even just a simple acknowledgement that a letter has been received. And even in instances where we have sent repeat request letters, or sought the facilitation of the Commission on Administrative Justice through the Information Commissioner. And as has been articulated, the requests have touched on a number of issues, and particularly dear to us as the Transparency International, given our mandate, was issues around the use of funds, targeting response measures. Particularly, we had asked, were interested in responses in regard to the implementation of mandatory quarantine, including information on financial costs that had been allocated for quarantine, and why Kenyans were being asked to pay this off their pocket at the beginning. Now, all the access to information requests made by us and by our partners have been premised on the life and liberty of Kenyans. Now, during this unprecedented crisis, it is very crucial that all accountability mechanisms remain effective, particularly the right to information, and which has a potential to play a major responses to COVID-19. And the transparency and accountability mechanisms that we put in place today will greatly determine how we recover as a country from this crisis. So that is why we'll continue to ask critical questions and ask for information in regard to accountability and transparency. The public has a right to know what policies and decisions are being to combat the spread of the virus and how they can engage and participate in these decisions, but they cannot be able to effectively participate without information. And our prayer is that all institutions involved must be transparent in order to respond effectively to the COVID-19 crisis. And requests which are particularly about accountability should not be ignored during the crisis, as they are very material to the protection of human rights and freedoms and the provision of critical services. The current emergency presented by COVID-19 does not allow government to act outside the frame of the law. It must conform to the Constitution. Thank you.
Thanks. Quickly go to Achieng. Orero, Staff Attorney, Women's Link Worldwide. Achieng, karibu.
Thank you so much. Good morning, everybody. My name is Achieng Orero, as you've been told. I'm a staff attorney for Women's Link Worldwide, and I'm on this petition as a 13th petitioner. And my role particularly is to highlight the gendered effect of the government's actions or inactions to provide information that is transparent, that is accurate, that is complete, and that is timely. Those are elements of the right to information that cannot be ignored, and particularly with regards to how it will affect the right to health. As my colleagues have mentioned, women and girls are the majority of health people who are offered health services at public health clinics, private health clinics, whatever the case. And the impact of the lack of access to information that is there on women and girls must be addressed by this government. We have seen high-ranking members of the government ceding to the fact that the increase in sexual violence amongst women and girls has been unprecedented, including the president himself in the address he gave on Monday. And whilst we laud, the effort to ask the National Crime Reporting Center to look into it, there must be also the health impact, the health services that must be offered to women and girls across the board. These services, whilst being available, if women and girls in this country don't have information as to where they can access these services, who is offering these services, the time that they're allowed to access these services, then hinders them from seeking healthcare. As my colleague Nelima mentioned in the beginning, we've seen instances of women being afraid to go to hospitals at certain times because of the curfew that was initially placed. This has had a negative impact, even to the point of death for some women, has been reported in the media. So our role in this, my role in this petition, is to highlight the fact that in the month of April, we did write to the Ministry of Health seeking information as to what reproductive, maternal, newborn health services are available, the comprehensive nature of these services, what time are they available, what time are they accessible, and as all my other colleagues have noted, not even a of receipt was received from the government. We're here to say that in times of emergency and crisis as such, the ones that we are in currently, the risk of violence is increased. The risk of violence, particularly to women and girls, is increased. And the orders to stay at home while keeping us safe from COVID and all the COVID-related issues, locks girls in with their abusers or suspected abusers, and they must have information as to how they can seek health services from various clinics. So we are here to demand actually that the government be proactive in its role of providing information, particularly where the health of women and girls is at risk. Thank you so much.
Asante sana. Thanks, Angela, and I'm sure you are comfortable with Swahili sometimes. So my right to culture. Now, Okioma, I think we want to go to, and thanks, colleagues. I think the issue of access to information and why it's critical in whatever we are doing for both our work and citizens, and what government, in fact, it's helped a lot in government achieving what it's doing by sharing. So it is coming and coming and coming from almost all the colleagues that we need to respect. We need to observe the right to access to information, because it enables people to do a lot of things that are even beneficial at the state. So I'll go to Erick. And Erick, as you introduce yourself, kindly help us understand what work you are doing, how the lack of access to information has affected your work, and what type of information that you have asked from the various state agencies and what you have not received.
Okay, thank you very much. Just like you had, my name is Erick Okioma. I'm a community health advocate, as well as a person living with HIV, as well as a TB champion, working in the community. And you'll realize that we are the end users of this information. We are the people who create demand for those services. And you'll realize that since the beginning of COVID, the issues of COVID-19, the way things have been done, they've not been done as they should be. And you'll realize that currently, as we speak, we rely on that information to handle certain issues. Let's say issues to do with, let's say, stigma. We have stigma and discrimination. We have people going for services, and you will realize that being community resource persons, we are very key in terms of ensuring people come to us. We have to refer them, we have to tell them what to do and all those kind of things. And currently, as we speak, it's becoming a problem because handling the COVID pandemic in terms of even involvement, information has been very scarce on how we go about it. And you know, information is something that is very critical in some of the decisions we can make, because we'll realize that currently we even have mothers are now going to the TBS in some in our communities other than going to facilities, because we really don't know how to go about it unless somebody comes and gives us guidance. And probably those are some of the critical issues that we feel we need to have, and then know how to handle the pandemic. And also, when you look at issues around implementation of right to health, on issues of what do we have, what resources do we have the PPEs, do we have so that we go about our duties in terms of, as we continue sensitizing communities, and actually also knowing the cost. You know, when you're implementing rights to health, you also need to know the cost, what is there. You have to be part and parcel of that design aspect, the implementation, such that communities can have buy-in. So you'll realize that if we have that critical information, it would be very key for us to talk to the users. These are the end users. They are the people who go to facilities. So without it, I think I don't think we'll be able to handle the pandemic the way it should be. And the other bit is that you'll realize that now when people don't go to facilities or to serve for services, even at different places, you'll realize that you end up incubating the pandemic, and other aspects. There are other things that can get out of control. Things like infection control of other diseases, because people don't go to facilities, people don't get those services where need be. And this one becomes a big problem, and now mitigating it becomes a cost on our side. And also the other aspect is when we look at even purchasing, some of the things, the way they've been purchased, no involvement, no engagement, no meaningful participation of communities in certain aspects, we are left blank. And I believe that fighting the pandemic is everyone's business, and we should be there, and we should have the information, and so that we can able to go about the business that we do best in our communities. And you'll realize, just like I said from the beginning, there are services which people get in facilities, like reproductive health services for mothers and other information that people get. And now, because of the way they started it off, the government started it off, was not the right way, because there are issues of around, we have stigma now. In fact, now we have stigmas, we have issues to do with TB, HIV, COVID now, and all those kind of things. And the perception in the community is that COVID is more of a crime than a health issue, and that is what is there. And unless the government comes out and brings the right information and engage the right people, such that we can so that we are part of the effort. And because of that, and it was not forthcoming, despite several letters that have been done requesting for all that information or engagement, such that it can help us do our work, and the information has not been forthcoming. And actually, that is why the reason why we are in this petition. Otherwise, I think this is something that should be done as much as yesterday. And I believe that the The government just has to come in and let us get what we really need so that we can save lives. Because even now, as we speak, we have entered a very critical phase. For example, I can give an example of like if you look at a county in Kisumu, a mother asking for an ambulance, it doesn't get an ambulance. It takes 8 hours, and you realize that when it's like that, and yet the information they say that some of those things people are supposed to get them at that in real time. Those responses are in real time. So when you respond to when people are just busy thinking about COVID up there, the grassroots really suffers. Otherwise, thank you so much.
Thanks, Eric. Thanks. I see I'm supposed to speak. We're looking at the time. But principally, from the media perspective, is at 3 levels. One, that quality content is the king, that people want quality information. In fact, there are now a lot of intervention on infodemics or something, but is it information that's of value? So journalists and media is concerned about quality information. So is there that quality information that can then inform quality content that would help Kenyans make the decisions they want? At a national level, yes, there are the daily press briefings, get a lot of information, but is that sufficient to help in other things? That's one of the concerns we have been having. So at a national level, yes, the press briefings are helpful, and they have been very helpful. But again, you'll also notice that not all media houses are allowed to participate. Now that's a challenge. 2, read together with the County Government Act, you start noticing that getting information, especially from the counties, has been a big challenge. Now, especially, we are moving to home-based care and whatever it is. We have devolved as it were. So if counties are not giving sufficient quality information in time, then how are we assessing their readiness? It becomes also a big challenge, and journalists have been struggling. A number of them have been making block statements of we have 100 million set aside. But if you ask the details of these 100 million set aside for to do what are the specifics, you rarely get the information. So that becomes a challenge. In fact, from 3 counties, we have had journalists being denied. In fact, in one of the counties, he was beaten up for asking these 100 millions that have been set aside, what is it for? So those are challenges. A number of them initially were talking about having set aside facilities that are ready and with beds. But when journalists went ahead to ask deeper questions, so that lack of information, in fact, affects the national government in making the decisions making, because if they are withholding this information, then they are not allowing even the national government to make the right decisions. So the right to information becomes that critical. So while it's not allowing journalists to give fully quality information, it's also endangering the lives of journalists where they have been beaten. Actually, we have 3 cases we have reported where journalists, having asked for information, were beaten up. Now again, it goes to other violation of other rights. A bigger challenge at a journalistic level, media is having is at this time, a number of media houses, journalists are working from home. Now, a number of our journalists are paid per the work they do. So if they are working at home and they don't access quality information to allow them to do the necessary stories, then again, that's affecting even their livelihoods, because they can't get quality information, they can't do a story that can then get covered by the media houses. At the end of the month, they're not paid. So again, it's a cycle of violations of other rights. So access to information becomes very critical to journalists in the sense that it will allow them get the right source, the right time, and do their work. So that has been a challenge. 3, as we look at it, is that media at this time, given the multiple sources of information, if we are not getting quality information, then the issue of credibility and reliability of even the information in the media becomes a challenge. Because remember, there is competition, obviously, as a business, the breaking news culture and the rest. So if, for example, the other channels have already gotten information and released, and the only thing that now makes difference between liberal media and online media is the credibility, quality, and professionalism that is added in the media. Because, for example, the numbers, everybody knows the numbers. Once the CS reads the numbers, everybody tweets, every Facebook has those numbers. But what what in addition to those numbers, the deeper statistics, the deeper analysis and trends are needed by the media to help people who read, even now those who work for newspapers, that this story will be read the following day. So if you don't have additional quality information, then again, it just becomes numbers. And that's what we're avoiding, because the purpose of media is not just to, they are not pipelines, just to relay numbers. But what do these numbers mean? What are the statistics? What do they mean? What are trends? So again, the issue of access to that information becomes very critical, because media is a big ally in crisis, and studies have been done that media, if used well, can help even government, especially in this phase where we are moving to public education and public information, that we need as much quality information out there as possible. And in fact, the Media Council is running a campaign for media, supporting journalists, media houses to do stories. So without information, this investment will also be a waste, because then why would you support somebody who will then get stuck with a story he wanted to do, but he doesn't have information? So it's the benefit of the government, national government, county government, to share quality, timely information with the media to help them in where we are now at a stage of public campaign to help in mitigating the effects of COVID-19. So it's of the benefit to share. So I think that's largely what I say. And I'll open it up for colleagues who joined in the discussion. Journalists who are present, I'd want you to ask our experts here and panelists to help us. Does the CS daily briefing qualify to be a proactive information disclosure, for example? Does it qualify? And other related. So anybody who would want to give it a first? Waandishi wako? I see two notes there, but they're not really questions, they're just comments. So that's why. Any question for the people who have joined in? Nelima, for example, would the daily press briefings qualify to be proactive disclosure of information, as it were?
Yes, so the daily press briefing is proactive and that is not prompted, but it's not sufficient. And that is why we've moved to court. And I think what we need to recognize is that it is important to build public trust in order to have an effective pandemic response. The countries that we have seen that have been effective in addressing the pandemics and have been moving towards flattening the curve have the trust of their public, such that when you tell the people or when you ask the people to do certain things like wear masks in public, observe social distancing, work from home, they will trust that this is our state and they're doing it for our benefit. And because you have a relationship of good governance, we don't have this relationship with our state. We haven't had it. Because 2010, we sat down to renegotiate our social contract and we said that we wanted a different state, but our state has refused to change. They've refused to meaningfully change how they engage with us as citizens. They don't want to tell us how they're spending the money. They don't want to tell us how many beds are there. They don't want to tell us how many healthcare workers have been trained, how many healthcare workers have been tested. Information that it does not make sense to withhold from the public. What would it hurt me to know that we might be behind in our pandemic response? That might make me more vigilant in my movement, but what I don't know, I cannot help. So when we need to prevent the spread of a disease, what we need to do is to have a state that is honest enough for the citizens to explain what is necessary from the citizens and citizens who trust the state. It is necessary for us to learn from other responses, firstly, but also to learn from history. We saw that the pandemic response of Ebola in the Democratic Republic of Congo, in Senegal, were hampered massively by a lack of trust. Women would not go to facilities because they thought that the government was trying to spread Ebola. In a sense, they had much more maternal mortalities as a result of a failure to attend clinic, not because the clinics weren't there, but because they didn't trust that the clinics would cater to them. So continuing to build mistrust with your people will not help in any pandemic response. We will continue to disrupt normal health services. Women won't go to clinic, won't go to hospitals. We might have increased maternal mortality. We'll have a reduction in vaccinations of children under 5. We will have people not accessing contraceptive services and other necessary services like HIV services, TB services, only because we are refusing to tell the people where to go, how to go, when to go, and because we're refusing to be honest about where we are in the pandemic response. And this is a continuous problem with our government. It was there in 2010, in 1990, in 1963. When do they plan to change how they operate?
Thank you. Now, maybe as we move on, maybe Sheila, would you help us understand? Somebody's raising an issue that getting information in from Makueni County is almost impossible. They only see on Facebook and the rest. How do you look at it in terms of access to information on COVID as we saw, and then the County Government Act? I think it's very clear, sections 94 to 90 something about access to information and how county governments must work to share information. Is it an ICJ? I know you worked with some counties to develop an access to information law at a county level. What will this help?
Yeah, Victor, thank you. I think we have the requisite laws in terms of access to information. We start from the Constitution, Article 35, which gives all Kenyans the right to any information held by the state. And of course, we also have the Access to Information Law. And for the county government, we also are enabled through the County Government Act, that as you have mentioned. And for us, and that is one of the reasons why we're going to court, to also test these laws and ensure that we use the provisions that have been provided in the Constitution and also legally to get the information that we require to exercise our rights and exercise and also get our rights and freedoms, and also ensure services that should be provided by the state, particularly during this critical point where Kenyans need various services to be able to secure their health, their lives, and their livelihoods. We need information to keep going, and also for us to also be able to make requisite decisions that protect us further as citizens during this COVID-19 pandemic. So for the county, I've not seen the question, but I think for whoever who is asking for that information from the county, I would encourage them, please go as far as you can. I know the challenge that we face right now is if we, even in civil society, in the places where we're able to engage, are not able to get information, then the critical question is then what about the common wananchi? What do they need to do to access information? That is what we're asking the government and other authorities. Just follow the law. Because if we were struggling where we are to get information, you can imagine now the person in Makueni who requires this information. What do they have to go through? So, but I would say, let us as citizens exercise our right. It's our constitutional right. And so let us try as much as possible to get information, particularly as I'm concerned about access to information on financial information and the use of public resources. Just maybe to add on to what Nelima has said in terms of the daily briefings, and we appreciate that, yes, we are being given information. You compare that with other countries and that is not happening. Yes, that's a step ahead, but we need even to go further and give Kenyans critical information on monies that are being contributed and that are being allocated, so we get information on what exactly are these monies being used for. Because at the same time, as we get information that yes, monies are being contributed, we're also getting information that in some hospitals, particularly at the grassroots, and particularly now with the concerns about county preparedness, we are and to enable our hospitals in the grassroots and in the counties also prepared. There are questions then: how are these resources being expended to ensure that all hospitals have PPEs, have the requisite PPEs to also ensure that our frontline health workers are protected, and services and health services, particularly in regard to COVID-19 cases, are well addressed. So access to information is critical at this point. Thank you.
Will help us. Does, for example, the Facebook messages and that we get from Minister of Health on their Facebook every day, in addition to the daily briefing, will that, because Alice Kemunto here asks, what type of information do they need to help them? They have not understood even what the implication of the curfews and the rest is. Now, do the posting of the speeches of the president, for example, and messages qualify, or is it helpful?
Right. I see the comment by Alice, and I think that goes to show that, you see, the information that we have received so far, even with the statement by the president, is not sufficient, so that the citizens of this country can therefore use that information to influence and make decisions about their lives to protect their health. And that goes towards why we're even in this petition, as we're asking for information, and this information must then result to citizens making better and informed choices. Otherwise, the information is not useful. Now, going to the Facebooks and the social media that they have been posting, I think we must recognize that that is a step, just as Sheila was saying, it's a step in the right direction, that this information is disseminated, not just on TV, but also on social media platforms. But let's also remember that these social media platforms are not accessible to every citizen. And therefore, it's not enough that this information is disseminated in that way. What happens to my grandmother in the village who does not understand the English that the statement has been written? Is it being translated into a language that she understands? How are you utilizing, for example, community radio and community other platforms where the community has access to this information? So let us remember that information and access to information is not just churning the information that we see the government doing. It is a step in the right direction, we agree. However, this information, for it to make sense in the principles that Article 35 has given us in the Constitution, this information must be given in a form and manner that is useful to the citizens to make informed choices. And as we're speaking about COVID-19, then it must relate to their everyday life. If you say that as Alice is commenting, if you say that now the travel restrictions have been lifted, what does that mean to Kenyan? Alice is asking, can I travel to the village? So which means that the press statement by the president does not help Alice and the other Kenyans to make decisions about whether they should travel and what health measures they should take in terms of protecting themselves, and which measures the government has put in place to ensure that those traveling up country, those traveling into Nairobi and other areas where the numbers of COVID-19 patients continue to be on the rise. So what does that mean to them, and what measures has the government taken to protect Kenyans, even who are coming into these places where the number of infections continues to rise? And therefore, to answer the question, that information is useful. However, it must be disseminated in languages and in manners that people understand, and that is sufficient to allow us to make informed decisions for the protection of our rights.
Thanks. And just to indicate now that I'm here, that the government has given money to community radio stations, actually 120 million to support nearly 149 radio stations and TVs across the country to allow debates and discussion on health COVID related. So again, those of you, especially Okioma and the rest who are in the communities, take advantage of these opportunities. And if you get any challenges, get in touch with the Media Council to connect you to some of those. And even your networks on the grassroots, help us we will connect you to the community radio stations for discussion for free. You will not be charged because government has paid for community for the next 3 months so that they help in the public education. So away from that, Vincent, now that we have 3 cases of journalists who have been denied information and some beaten, do you want to take up that matter on behalf of those journalists? What is their right? What do these journalists do?
Of course, Mr. Victor, as you said it, journalists require that information, first of all, to inform the public, because journalists have the right to, they have a responsibility to inform, to educate, and to entertain the public as the core mandate of the media. A journalist also requires information for him to enforce his right to work and to earn a living. So the civil and political right of receiving information is tied to the right to work, which is economic, social, and cultural rights. And therefore, any journalist denied that information has all the rights to talk to us, so that at least we make the requisite noise And if that noise is not enough, we can sue, we can create a lot of nuisance in court. You know, some of these cases, public interest litigation, some of it, sometimes we file for nuisance value. Not most government offices and officers would like from time to time to attend court and answer questions. So therefore, any journalist who feels that he requires information and that information is being denied, he has all the rights to talk to advocates who or not even advocates, even other people. We have seen Okioma, one of the leading public defenders in Kenya, doing a lot of work, including advancing the jurisprudence on access to information. So I believe journalists are well informed. They can talk to us. We can even train them on how to enforce those rights if the avenue for them to get an advocate is not available. It's possible, and the right to information, as you put it, is very, very, very important in a democratic society, because it is tied to other rights like even public participation. As I had said earlier, how would you participate how would you exercise your right to public participation if you do not have the information? Because the person who has the information will trample on any other person that does not have information. And on stigma, Okioma talked about stigma. It's very sad, because this stigma has an aspect of discrimination. And I believe you all know, you have seen it. There are some people, the rich, who have lost their loved ones, maybe from other causes, but not necessarily COVID-19. And we've seen they require masses. They are even more than 100 people, and they are conducted in a more dignified manner. But when a poor person dies in Muranga, in Kiambu, or in Nyanza, they are buried at night. While require mass are conducted for the rich people in a very dignified manner. So this COVID-19 has, people say that it has equalized people, but we have seen some aspect of discrimination in the way that the poor people are forced to dispose of their loved ones. So that's another issue that we probably will be telling the court to, although we have evidence of it, including the annexures that we have put in the affidavit, we'll be telling the court to take judicial notice that this stigmatization and disposal of the dead has some discriminative aspect of it, in that some rich people are being buried with the decency that we are supposed to dispose of the dead. And with the time, we've always been talking about contempt of court, contempt of this. I believe it's about time that we also become very, very creative in the way we come up with the remedies. I think with the time, we'll be asking the court to issue declaration that certain people are in contempt of the Constitution, or certain people are in contempt of certain laws, like, and even contempt of the citizens, because a citizen demand for information that has been generated using his resources. And therefore, if the ministry cannot even respond, we have, in this petition, we have 5 good letters. 5 good letters that have been annexed from April, I think April 4th, all the way to April 21st. All those letters have not been responded to. And that's a problem with the Ministry of Health, because from my own private engagement with them, I know they do not even acknowledge receipt of any inquiry you make on how, and especially on how sometimes they issue those certificates for people with disabilities. Sometimes you write to them asking them how someone who was declared disabled has all of a sudden been declared, been removed from that disability criteria. They don't answer. They just don't. And I think the best thing is for us to be going to court to enforce those rights and create a lot of nuisance to them, because while they may ignore letters written by citizens, at least they would honor summonses from courts. Thank you.
Thank you. Amos Kemboi from Masai Mara University. Mzalendo Kemboi.
Yes, I'm getting you, Mr. Bwire.
Yeah. Hebu tuulize kutoka Narok tusikie unasemaje.
I would like to inquire, first of all, what interventions have we made to make those information holders in various government institutions that ATI, access to information, is a critical aspect in ensuring that we have free access to information, owing to the fact that most of them or some of them might not understand the essence of giving out this information, the fact that they might not understand the real classification of information from the critical, confidential, so that whenever somebody, or let's say a journalist or a civilian visits and inquires for information, every information is critical. It doesn't warrant revealing. So what interventions have we done so that we can have civic education, both of those information holders and also the civilians and also some journalists, because they need to understand also why once you've been denied information, what levels of intervention are you going to take so that you can maybe get information from an higher authority, or how are you going to reach the appellant authority so that you can at least have access to information on another platform? And another question also is, as we go ahead, tunapoangazia swala hili, tunapopiga hatua katika shughuli hizi, je, ni mbinu gani itatusaidia hasa kuhakikisha kwamba uhuru wa kusambaza habari ama wale kupokea habari watakuwa na uhuru 100% kienda katika miaka zijazo, hivi kwamba kusije kukuwa na kikwazo katika miaka zijazo, ili kila mtu aweze kuwa na nafasi murua. Asante sana.
Asante Mzalendo kutoka Narok. I think that question would also relate to one we got here in terms of classification. Somebody asked in terms of would the court maybe deny or look at the issue of what is classified information and related. Nelima, maybe you want to give it a go?
Yeah, thank you so much for the question. So in terms of information that is classified, this is why actually we have the Commissioner of Administrative Justice as a respondent, because this is primarily their role. They should be giving ministries, state agents the capacity to understand the obligation to provide information. That is why we need regulations in place. They have failed to do so 10 years of the Constitution, and they have failed to even make any attempt to address this gap. So we understand that there is a gap in understanding among the ministries, but who must address that? Because you cannot continue to collect taxes and then claim an incapacity on your part. If you cannot do the work, then don't collect my taxes if you don't plan to actually play your role. And that's the Commissioner of Administrative Justice, the Ministry for Information and Technology, working with every other ministry to give them the necessary capacity to provide information to citizens. One, information that is sought, and 2, information to protect life and liberty, which must be provided within 48 hours. If CAJ had been working with the ministry before now, they would have had regulations in place that would have been able to tell the ministries, this is your obligation from step A, B, C, D. And your question is very important because you don't know. And the thing is, neither do we. We don't know how long. If I send you a letter and you don't respond within 48 hours or within 2 weeks or within 21 days, I don't know what the next step is. Do I go straight to court or do I go to CAJ? This would have been avoided if CAJ had been doing its job, or if the ministry had been doing its job. Secondly, the Act is quite clear that information can be classified and that any information that is classified may not be shared, but those reasons must be provided to you. If you ignore me, I don't know if that's why you're not giving me the information. You have to tell me that it's been classified. And then the Act has to have regulations on how information is classified. Another thing that the ministry and CAJ have failed to do. So the ministry can just say, how we got the 10 billion, that's classified. What you're spending that 10 billion on, that's classified. Why? I don't know why it's classified and you won't tell me. So one is your failure to respond, then I don't know why you're not responding. Secondly, if you want to classify information, there have to be necessary steps that you follow. Thirdly, if you do classify it, you have to communicate why you've classified it. None of these things are happening. None of these things are happening because the Commission on Administrative Justice has failed in its mandate. The Ministry of Information and Technology has failed in its mandate. Ministries might not know, but their failure to know 10 years of the Constitution is no longer my problem as a citizen. They have to meet their mandate.
Thank you. And Achieng, maybe somebody asks here, now that you went on, I mean, your strength you mentioned is on gender and related, I mean, your interest in issues of this petition. But somebody has also asked, would you consider issue of disability? People with disability are also asking, would they be part of your thinking in strategy? How do they access information? I mean, so much information is being channeled out there, but is it disability friendly?
Thank you for that question. And I think it's a very important aspect that we have seen the government has also failed to provide any mechanism. Fine, we have during any mechanism that can be used to serve the persons who are living with disabilities. The right to access information gives every citizen the right to access this information. It's not stratified, and where the government fails to provide this right, then it's discriminatory. It's discriminatory against those who can't access mainstream methods of accessing information. Secondly, the government also has the proactive right to disseminate the information. How the information that they give is disseminated is their role. It's not on me as a citizen to go on Facebook or to log into whichever channel that has been used to disseminate this information. It is the proactive prerogative of the government. It's their obligation to ensure that every citizen has access to this information. It's not only to make sure that the information is available, but to disseminate it to the lowest levels, to the villages, to homesteads and all that. And particularly with regards to a pandemic, as my colleagues have mentioned, this information goes to the root of life and liberty. So COVID-19 does not discriminate, as we have been saying throughout the last 4 or 5 months. It doesn't choose that it only affects certain members of society, even people living with disabilities, women and girls, the most vulnerable, the most marginalized members of the society have a right to access information. And it is the obligation of the government to provide information in the manner that all citizens are able to access this information. And I think this petition is working to ensure that the court gives a pronouncement to that effect.
Thank you, Achieng. Joseph Wangendo, please. Joseph?
Yes, you can hear me?
Yes, please. Go ahead.
Yeah, I'd sent in a question earlier, but I joined in late, and my apologies. I needed to find out. I work in the blood transfusion sector, and we know that the funding from the World Bank, which is a credit line, the 50 billion that was given, the 5 billion Kenya shillings, 20% of it was supposed to be used by the blood transfusion service. Now, as far as I'm concerned, that service is actually not operational as we speak. And my concern is because it's a sector that's been, there's a lot of corruption that's been going on. How are we going to make sure that this money, because again, it's borrowed money from the World Bank and we're going to pay it back. How are we going to make sure patients are dying? There's money we borrowed to help these patients access blood and they're not accessing it. How are you going to make sure that money that was lent to us is actually, I've tried to monitor in my role as a civil society, and working in that space, but information is not accessible. The ministry shuts all the doors. The new CS, when he came in, appointed us on an advisory board, which was gazetted and disbanded within 2 weeks, because I guess people didn't want us to access that information. So I'm at a loss on how to get this handled. And I'm hoping, part of the petition could raise some of these issues. Thank you.
Fundamental, and this one we have no alternative but to ask Sheila to help us in terms of what does Joseph do? Sheila, please.
Yeah, I don't know whether Joseph has in terms of trying to maybe even just request this information. That's a good first step. But as I said, that's one of the things we have done, and we didn't get the information. And I don't want to sound pessimistic, but it looks like that kind of information will not be proactively disclosed. I think herein and even for previous administrations, I think getting information from certain ministries, particularly Ministry of Health, it's like pulling teeth, really, trying to get that kind of information on financial. On critical financial aspects. So my own recommendation is we hope that this will be able to, this case will be able to set the requisite precedents in terms of access to information, including financial information. But I think in addition to that, there are certain things that we also need to be calling for. We've also raised concerns about the use of how we're using borrowed money. We're acquiring debt that is going to be paid back by taxpayers' money, but we're not accounting for that debt. We're not showing or demonstrating how we're using that money. And it is important, and that's one of the things we're trying to also get government to do. All the monies that they're borrowing from financial institutions such as the World Bank and IMF need to be well expended and well accounted for. And maybe one of the things that we need to also call for, Joseph, is ask that this kind of monies are subjected to regular internal audits so that we are also able to curb any loopholes before it is too late, because sometimes we wait for too long before an audit is done. But in fact, it's one of the things that we've called for even in the COVID-19 funds, that we need to have a system of regular audits so that you don't wait for such a long time before you realize that something had been going wrong. And by that time, it's water and money under the bridge. So calling for regular internal audits is one of the ways in which we can be able to institute some remedial measures to ensure that we safeguard our resources against any mismanagement or losses from the onset. And one of the things that we've also asked is that the Office of the Auditor General is more active and more alert in terms of how we are using monies. Of course, now for this particular period, we have a special concern on how COVID-19 funds are being used, and we've asked that they ensure that there are regular audits as well, but not just for this, but also monies that have particularly been borrowed to support different aspects of development in this country.
Thank you, Sheila. I think we have a short time. It's interesting. We need to continue, but I am sure other people are in engagement, and I'm sure some of my journalists and friends in the bundles are already threatening them. So I'll go to Teresa to give us a wrap, and then we open it up for another discussion another day. So Teresa, Karibu.
Thank you, Bwire. I think as a way of closing, it would be prudent to just indicate what the direction of the court was from yesterday, because yesterday we were in court for a mention, and the court directed as follows: that the respondents do respond to the petition that we filed within 7 days from yesterday. The court also directed that we make our submissions as petitioners within 7 days, and that those respondents who did not appear, because some of them did not, that they are served by today. And the matter will then be mentioned on 23rd of July, so that the court can confirm that all of us have complied with the directions of the court. Also, in closing, I would like, on behalf of the petitioners, to just thank the civil society movement, because the number of civil society organizations that were involved are much more than there are petitioners. So we'd like to thank them and thank the civil society movement working on health and rights issues that came together and saw it fit to follow. And it's not just in this petition. We've done a lot of advocacy issues and we continue to do so. We shall not relent. We continue to do so. We encourage callers like the callers from Narok and the current caller that we've had to continue in this fight, to demand, because the Constitution then gives us the right to demand of the state to do their part. And so to continue demanding, do not relent, even when we do send letters and requests for information and they do not come through, continue to do so. And we have faith in our justice system and in our courts that they will find the right decisions and that this will be a groundbreaking decision towards the implementation on access to information. Finally, we would call on the government and state departments and ministries to go ahead and begin to give this information. The court does not need to say so for you to give this information. Give this information to the public, allow us to make decisions that are informed, to give the counties also opportunity to interact with their members, give this information to your citizens so that we're able to make information. Thank you very much.
Asante sana. Tutaki kuongeza ama kupunguza. So on behalf of colleagues, once more, I thank you, those of you who joined and those who have been with us. Let's continue interacting, talking. There are Twitter handles there, there are Facebook. Continue engaging the panelists. They will answer your questions even outside this formal press conference. Other than that, thanks and good day.
Thank you.